Well, welcome everybody. Thank you so much for coming tonight. I wanted to tell you a little bit about what I do. I don't just do hormones, but I want you to talk to you a little bit about functional medicine, because functional medicine takes into account everything. I chose the topic hormones because hormones control everything. But I like to empower people to know that you control your hormones. And I want to go through several different hormones and how you control them and what the functional medicine approach is to hormones. So hormone imbalances can result in a variety of symptoms, and a lot of them are mood, depression, hot flashes, lack of sex drive, migraines, PMS, pre-postmenopausal, trouble sleeping, weight gain, anxiety, decreased libido, depression, erectile dysfunction, irritability, loss of muscle tone, poor concentration, and weight gain. Men and women experience hormonal imbalances somewhat differently, but we all experience hormonal imbalance. So what affects hormones? What you eat, what you drink, how much you sleep, how much you exercise, the toxins you're exposed to. All of this affects your hormones. You know, we need to live balanced lives, but we're always juggling from one thing to another. If one day you have stress and then the next day you get, you know, you're eating a fish with heavy metals in it, or maybe you had a lot to drink the other night for a party. All of this can wreak havoc with your hormones. You know, I have some people that have been on hormones for years and years and years, and I've never had to change the dose. Their life is pretty stable. And I have other people, their diets are erratic, they're racing cross country to see ailing parents, they're taking care of children, their life is full of stress. So really, it's your lifestyle that affects the hormones.
Is that why you have stress twice? Because stress really affects hormones. It's like unbelievable.
Stress
trumps everything.
It does. It totally does. And you know, it's very funny. I had another woman, and just like, you know, she was in my office the other day. I'm not stressed. And then I started talking about what's happening in the life, and then it came out like a tsunami. And I was like, oh my God, that's stress.
Right.
But stress is not just mental stress. That's what everybody thinks it is. They think, oh, you know, I'm fine, everything's fine. It's physical, it's hormonal, it's metabolic, it's pain, it's cold, it's heat, it's lack of sleep. Stress can be anything that your body perceives as being out of balance. So it doesn't, you know, when you ask people if they're stressed, it's not necessarily a mental stress. But this is what functional medicine is. I mean, your symptom, people come in and I'm tired, I'm irritable, that's this guy. Like that's what you see. But what functional medicine does, it gets down deep into the root cause. What's the reason for that? What is the reason? Is it digestion, genetics, trauma, toxic thoughts, lack of exercise, nutritional deficiencies, poor relationships, lack of sleep, toxins, poor diet, stress, inflammation? All of this contributes to any of those symptoms up there. And that's really what functional medicine does, is try to uncover all of that. So cortisol, that's the stress hormone, and it's the major ager because it breaks down muscle, bone, raises blood sugar, raises cholesterol, raises your heart rate. So I like to do cortisol and saliva because I show people these graphs. So you see that graph there with there are no names on here, but you see that where it just jumps up into the red. I remember having a patient one day, and I said to her, look at this and tell me what happens at 11 a.m. This was a yoga instructor who was so mellow and calm, and she taught meditation. And then she burst out in tears. She said, you know, I come home from yoga class and my son is there smoking pot. And she would never admit she was under stress, but that was eating her away. Once you develop an awareness of what's going on, then you can deal with it. So she then realized this is affecting her hormonally, and she's going to do something about it. You can't change the stressor, you can change your reaction to it. This other scenario is very different. This is what you see in fibromyalgia, chronic fatigue. You know, somebody, you see them and they like look empty. They're you know, the circles under the eyes, they're tired, they're slow, they barely get up out of bed. You know, I call it flatline. But these people need, it's still cortisol, the stress hormone, but they need to be treated somewhat differently. So that knowledge is power, and then that's how I try to help people by figuring out, are they stressed? Is this stress affecting them? And then what is the cause of the stress? So I usually treat high cortisol with, you know, making sure you sleep, avoiding sugar, stimulants, caffeine, alcohol, simple carbohydrates because it raises cortisol. Adaptogenic herbs are very important. I call it training wheels. You know, it doesn't make cortisol go too high or too low. It makes your body more resilient to stress. And then also getting to the root cause. Is it work? Is it life? Is it work-life balance? What is the stressor that's bringing that to light? So that's how I treat high cortisol in a nutshell, but there's always more to it because all the hormones interact with each other. So when your cortisol goes up, your blood sugar goes up, or when you eat the, well, these don't have too much any sugar, but you eat something sugary or simple starch or drink alcohol, it's going to raise blood sugar, and blood sugar is going to raise insulin. Insulin is another major ager because it causes you to store fat. Cortisol causes you to store fat. I'm actually doing a 90-minute lecture, everything makes you fat. It does. But high insulin is like alcohol to an alcoholic. So the more sugar you have, the more starch you have, it's as addictive as cocaine. And you become resistant because it's going to drive insulin up, and your body after a while is not going to respond to it. So you need more and more insulin to drive the sugar into the cells, and that's where you get insulin resistance, metabolic syndrome. And you know, we treat that with withdrawing the cause of it. So other things that will treat high insulin are watching. You see this graph, the sugar spikes are going up. You know, that's the difference between juicing, it's going to go up high and then drop quickly, versus eating, you know, eating the piece of fruit or eating the vegetable. It goes up slowly, comes down slowly. So teaching people how to modulate their intake, combining sugar with protein or some fat so it does a slow release. Exercise is extremely important, losing weight, fish oil, and there are other supplements that I use as well to treat insulin resistance. So I know I talk to people about food all the time, and they like to fool themselves, you know, like, look, I eat rice cakes and I eat this and I eat that, but we're all subject to that marketing hype. And we were just talking about milk before. You almost thought it was sinful not to give your child milk. But that's not necessarily healthy for them. So the cartoon is, I know it's pepperoni, but I'm telling my stomach it's just a low-carb banana. But that's what people do when it comes to food, right? I see the heads nodding. We're all making up stories about, well, I had quinoa pasta or rice pasta. You know, it's still a carb. Still, not so much quinoa, but it's processed. It's anything that's ground up. It took away the work that your stomach was going to do. So just beware, we're all fooling ourselves. And testosterone. I talk about testosterone because testosterone gives people a sense of well-being. You know, women who have low testosterone, it's not just about libido. Men, it's always about libido, but it's not just about libido. It's building your muscle. It's feeling a sense of empowerment. The women whose testosterone is low, they're weepy, they're teary. They say, I was a powerful person and I don't have that ambition anymore, and I'm sensitive to things that they never bothered me before and now they bother me. So testosterone is a hormone of well-being. It's a hormone of muscle strength, endurance, power, strength. So it's a secret weapon to manage stress better. You give a tiny bit. Men whose testosterone are low, they're couch potato. They just don't feel good. They're going to feel different, and they're not going to articulate it in the same way a woman would, but they're just going to say, I don't have that ambition anymore. I just don't have the strength and endurance. So it's important. And I like to do things naturally, because the things that are going to help testosterone are lifting weights, heavy weights, getting some sunshine and natural vitamin D. And when you have to replace, you replace. I usually try to find every natural way first before I give a hormone. And testosterone is usually the last hormone I give, but little dab will do you sometimes. You know, when you need it and you can't get your work done and you're feeling horrible, testosterone can really help. So I wanted you to know that hormones are interconnected, and everybody's lowering cholesterol so much, but cholesterol is the backbone of all your sex hormones. Cortisol, you need cortisol to live. Estrogen, progesterone, testosterone, DHEA, they're all interconnected, and I have to try, if I'm going to do any hormone replacement therapy or natural therapies, I have to know which direction people are going in. Because sometimes that's what you eat, what you drink, how much you sleep, how much you exercise, the stress you're under, and also the genetics is going to determine how you process the hormones. Because people don't realize that testosterone changes, and progesterone turns into either cortisol, DHEA, or testosterone. Testosterone will turn into estrogen. Estrogen can be metabolized different ways, or testosterone can turn into a stronger testosterone. So the important thing that I do is look at the metabolites and what direction are the hormones going. So testosterone can go to estrogen or DHT. Do you ever see a man with big belly and big boobs? This is testosterone going to estrogen. And you treat it naturally at first. A little zinc, losing weight, decreasing alcohol, and sometimes herbs. And I also look at genetics, because, you know, women with a history of breast cancer, men with a history of prostate cancer, I do genetic testing on them, and a lot of them will come and look and say, oh my God, I know why that happened to me. Because you know they turn their testosterone into estrogen into a carcinogenic form. And you know, you can treat that nutritionally. But I empower them with reports and data so that they can reverse it and go down another street, and they know exactly how to prevent it. Because I do see a lot of women post breast cancer surgery or chemotherapy, and they're scared. I'm not going to give them hormones, but I'm going to give them a lifestyle that's going to prevent recurrence. Thyroid is another biggie. You know, there's so much that affects the thyroid, especially high cortisol and stress. It actually blocks the thyroid from working. Low progesterone will block the thyroid from working. There's so many different things. Thyroid is the hormone of metabolism. It keeps you slim, it keeps you sharp, it helps with memory, it helps with IQ, it helps with temperature control. It's a very important hormone, and everybody who's overweight says, I just hope it's my thyroid. But it's, you know, unfortunately, it's not always the thyroid. And what's different in functional medicine is, you know, the range of normal is huge. You know, what's the difference between dying of thirst and being a little dehydrated? There's no cutoff point. It's a gradient. So I tell people when they come in with a blood sugar of 99 and then you're okay, that's normal, and 100 is pre-diabetic. Well, 99 is so close to 100. It's the same thing. But thyroid is looked at very differently, and the range of normal is so wide that people feel hypothyroid or hyperthyroid at the edges. So what we try to go for is the happy medium. And what's considered normal is not necessarily optimal. And what we do in functional medicine is look at where all your values of any of your hormones, nutrients, etc., are optimal and not just normal. So that's, and a lot of endocrine societies have adopted these values. However, it's not generally practiced. Again, some of it is a cost, because then everybody would be on thyroid hormone, or some of it has to do with insurance reimbursement. So there's a lot of politics in medicine, but I try not to play politics. I individualize treatment, and I offer people what they need, and I give them choices. Estrogen and progesterone balance, or is a really important concept for women of any age. Because teenagers, their hormones are ramping up. The thing that happens first is estrogen goes up, and they're not ovulating yet because their bodies aren't in sync, and they get pretty tough. Anybody who's ever had a teenage girl knows how, moody and irritable they become. PMS is one side of the coin, and when you're, many women have a nice middle age, and then when they hit perimenopause, it's the flip side of PMS. The hormones are ramping down instead of ramping up. Too much estrogen in relation to progesterone, I call estrogen the hormone of energy and growth. So too much energy is anxiety, irritability, insomnia, impatient, snappy behavior, growth of the breast, growth of the belly, the hips, the thighs, cysts on the breast, cysts on the ovaries, fibroids, heavy bleeding. Any of those symptoms can be a sign of estrogen dominance. And I realized I was estrogen dominant most of my life. But when you bring down the estrogen and you bring up the progesterone, you're balanced. So we try to keep estrogen and progesterone in balance because progesterone is a hormone of peace and calm. P, progesterone, peace and calm. Too much, you're groggy, foggy, depressed. So we're always going through that little happy medium, and it's always a seesaw. But you can get closer to the norm. And that's exactly like what happens. Men can get estrogen dominant too. That's where the belly and the man boobs come from. And the women hold it right here, exactly where we don't want it. And there's an estrogenic look. So that's part of the physical aspect of estrogen dominance. And too much estrogen is no good, but too little estrogen is no good. Less hormones, more weight. Everything makes you fat. So with age comes wisdom, huh? Apparently, wisdom weighs about 40 pounds. So we have to have hormones in balance to maintain our weight. And when I give any kind of hormone, people get scared of hormones, but there's so much literature. You just go to my website. I wrote hormone replacement options for men and women, and I link to the actual studies to show exactly what I do, why I do it that way, and that it's scientifically proven. If you give estrogen by mouth, it goes through the liver first and it causes clots. That's why they stopped that study, the Women's Health Initiative, because they had increased clotting, which either caused strokes or heart attack. However, if you give estrogen through the skin, either in a cream or a patch, the chances of clots are negligible. So the way you give a hormone really makes a difference. So there's a lot of different factors that you have to get into when you're deciding on if you want to replace hormones. But I always start with lifestyle first. So we have a lot of estrogens in our environment, and heating in plastic, hormones fed to our poultry, our meat, personal care products that have phthalates, parabens, herbicides, pesticides, all of these make you estrogen dominant. This is why young women are reaching puberty early, and you have young men who are infertile because it's causing this imbalance. So decreasing toxins, decreasing stress, getting enough sleep, exercising, eating right, all are going to affect your hormones. So the recipe for health is exercise, eliminate toxins, eat a healthy diet, get enough sleep, have a healthy lifestyle. And that's really the whole functional medicine approach, from toxins, stress, hormones, genetics, dealing with the whole person.